The Kent County Medical Examiner's Office released its annual report, and it starts with a salty letter from the Chief Medical Examiner scolding local hospitals. The letter says despite numerous requests, the hospitals are not helping to track overdose deaths. 24-hour News 8's Heather Walker is live outside the Medical Examiner's office working to learn why. Heather?
Yeah, well, Sue, Target 8 has been documenting this epidemic that's been happening here in West Michigan, this opioid epidemic, and it's clear that it's a problem, but the medical examiner's office says that hospitals aren't doing their part because they are disposing of critical blood samples from patients.
Then we're never going to know.
In order to solve a problem, you have to first learn what's causing it. Kent County Chief Medical Examiner Dr. Stephen Cole says he can't do his part without help. In his report, he praised law enforcement for aiding, saying they will submit drug paraphernalia found with the deceased, but added, unfortunately, the same cannot be said for Grand Rapids area hospitals.
I've asked and asked and asked and asked.
Dr. Cole says too often patients who are believed to have OD'd are given a urine test. Those tests don't detect important drugs like fentanyl. And once it's assumed that a patient overdosed on something, they go into intensive care until they pass away. In the meantime, the patient's blood is thrown out, blood that could determine what drug and how much of it caused the death.
I think the problem is if somebody's basically brain dead, there's nothing you can do for them, and they don't want to do any, quote, unnecessary testing. It doesn't make any difference to them why the person got to that point. So because they're not reimbursed by insurance companies.
Whatever the reason, the consequences trickle down. The drug dealer that sold the drugs can't be prosecuted, and the families are left without a cause of death for their loved one.
Hopefully this will bring about, or at least help bring about, an improvement in our ability to determine the cause of death in every drug overdose.
Now, Dr. Cole's office says that he deals with 1 to 2 of these cases a month. We did reach out to the hospitals for a response. Spectrum Health responded, saying in part, quote, "We value our relationship with the Kent County Medical Examiner's Office, welcome discussions, and will continue to work together to better serve the people of Kent County." Metro Health also responded, saying, "We are aware of the report and are taking time to carefully review it." Mercy Health did not respond. Now, if you'd like to see that full letter and report, we have it up right now at woodtv.com. Reporting live in East Grand Rapids, Heather Walker, 24-hour News 8.